If you want the shortest recovery from your Asian rhinoplasty, listen to this video. I'm Dr. Shim Ching, based in Honolulu, Hawaii, board certified plastic surgeon. I've been doing Asian rhinoplasty for 25 years. Asian rhinoplasty is very common. I would say that eyelid surgery and rhinoplasty are the two most common procedures that are performed in Asian cosmetic surgery. If you look at Korean dramas, Korean pop stars, most of them have had this kind of surgery done. Both the eyelids to make the eyes larger, a larger fold, and usually some sort of rhinoplasty to improve their appearance. Extremely common, and I have to give credit to my colleagues in Korea. They've done a fantastic job developing this field because it is somewhat new. I think the pace of innovation in Korean plastic surgery is unparalleled, and they have refined these procedures so well that they can get very nice results, very beautiful results for their patients. Initially, when I first started, I noticed that there's a lot of Asian patients in Hawaii. Our island is about 80% Asian, so I really felt the need to travel to Korea and Japan to learn all these techniques. I really enjoy doing this procedure. It's a little bit different from what my colleagues do on the mainland US, where it's primarily Caucasian rhinoplasty that we're dealing with. And if you watch my previous videos, you understand maybe some of the differences between them. Caucasian rhinoplasty, we're making the nose smaller, whereas in Asian rhinoplasty, we're building up the nose, usually bridging the tip, so that the nose is more prominent. It's a completely different procedure and requires very different techniques. Over the course of the last 25 years, I've experimented with different techniques to try to make the procedure better and recovery shorter. I have three things that I do that I like to share with you so that you can understand how your surgery can be a shorter recovery, less painful, and overall a smoother, better experience through refinement of techniques. First point, the bridge. For some reason in the US, my colleagues don't like to use implants. They almost always use some sort of cartilage, usually rib cartilage, harvested from the patient to build up the bridge. There are different techniques. DCF, where they chop up the cartilage very fine and then they wrap it in a layer of fascia and they put it in the bridge to take the place of an implant. You can take the cartilage from the rib and you can carve it into a piece and place it on the bridge, and that's another way that the bridge is built up. In Korea, for example, and in most Asian countries, the most common way to build up the bridge is with an implant, and we use a silicone implant. There's a smooth silicone implant similar to what we use in the chin and also other areas of the face like the tear trough or the cheeks or the jaw. I think silicone implants got a really bad reputation in the US because surgeons would see a lot of silicone implants that would come out of the nose after time. We do know that there's an unsafe way to use implants in the nose and there's a safe way to use the implants in the nose. And when implants in the nose are done properly and safely, there really is no issue. And I know this because my colleagues in Korea almost always use silicone implants in the nose and they don't have any problems. I myself have put in hundreds and hundreds of nasal implants and there really is no issue when the procedure is done correctly. The procedure is done incorrectly when somebody tries to put in a really long implant or what we call a L-shaped implant that's shaped like this to try to make the nose project out. So there's a lot of tension on those implants. And I took out one of these implants just a few days ago on a patient who was in Japan because the surgeon tried to make the nose longer and pointier with the implant. That really is the unsafe situation. When the implant ends here and there is no tension on the tip of the nose from the implant itself, then the implant is stable, it's safe, and it doesn't have any problems. First point is that if we use an implant for the bridge of the nose, recovery will be shorter. An implant goes in the body, your body doesn't react to it, the implant doesn't change in shape or size, you have a little bit of swelling around it, but that gives the shortest recovery. This is in contrast to taking a piece of your rib, which is extremely painful. It's like breaking your ribs. You have a cut underneath usually the breast or on the chest in a male, which is another scar on your body. Because that cartilage goes in and then your body starts to resorb it, there's a lot of swelling in response to it. So using a silicone implant in the bridge will drastically shorten your recovery. Second point, I've harvested many rib cartilages from patients, and that is quite a painful thing. We can avoid that completely by using what we call donor cartilage. Now, donor cartilage is cartilage from another human being that's been taken from them because they've donated their body. Some patients have a problem with that, but I can assure you that it's very safe and it works very well. is very similar to cartilage that we might harvest from the patient. It has the advantage that I just take it off the shelf. It's actually frozen, and then we thaw it, and then we use it. And again, using a donor piece of cartilage can drastically shorten your recovery because you don't have a cut on your chest, and you don't have the pain associated with that rib harvest. The cartilage does the same. I slice it into the pieces that I need to build up the tip of the nose. And as I discussed before, using an implant to shape the tip of the nose is not going to work. That is what's unsafe. We always use cartilage to build up the tip of the nose, and that's really the correct way to do Asian rhinoplasty. Third point is breaking bones. So we often do some sort of bony work in rhinoplasty, and Asian rhinoplasty is the same. The usual thing that I do is to narrow the bridge because the bridge can be quite wide in some Asians. So along with putting something in the bridge of the nose like a piece of silicone, I need to break the bone on either side to narrow that part of the nose. Your nose is made up of bone up here, cartilage down here, and to make this part more narrow, we need to break it on either side and push the bones in. The usual approach to breaking bones is to use basically a chisel. The fancy surgical name for that is osteotome. And a surgeon will use that chisel and a hammer to cut the bone along here. It is fairly traumatic. It causes bleeding, and bleeding will cause swelling and bruising. And although this is a very common thing that we do in rhinoplasty, there is a way around this. And there is a way to do this better. I use an ultrasonic saw. It's called a piezotome. It vibrates very, very quickly in the ultrasonic frequency, and that vibration will allow me to cut the bone without causing any bleeding or damage to what we call soft tissue, with everything that surrounds the bone, including little blood vessels. So it's just a much more gentle way of cutting bone, which will reduce swelling and bruising afterwards. And that's a third way that I can really decrease the amount of recovery from an Asian rhinoplasty. So we covered three things. One is to use a silicone implant for the bridge, which will really lessen your recovery. Number two is to use donor cartilage, which will avoid the harvesting of the rib from your chest. And number three is an ultrasonic saw to really limit the amount of bruising and swelling after breaking the bones of the nose. So I hope you enjoyed listening to this video. This is Dr. Shim Ching. Please give us a like down below, comment down below, subscribe to this channel. Stay tuned for more content like this.